We are from the Department of Pediatric and Preventive Dentistry, MGM Dental College, Navi Mumbai, and the topic that we'll be discussing today is indirect pulp capping, also known as IPC. So indirect pulp capping is a procedure performed in a tooth with a deep carious lesion approximating the pulp but without signs or symptoms of pulp degeneration. So the indications of this procedure are that there is a diagnosis of reversible pulpitis, and if complete caries removal is done, then we'll be entering the pulp chamber. The contraindications of this procedure are any signs or symptoms of irreversible pulpitis or pulp necrosis. Now, earlier this procedure used to be carried out in 2 steps, but recent literature shows that 2-step procedures, when we re-enter in the 2nd step, causes pulpal exposure, and hence we do it as a single-step procedure. And when a good hermetic seal is achieved, the carious process arrests itself and the pulp remains protected. The objectives of this procedure are that intermediate or final restoration should seal completely the involved dentine from the oral environment. Now, the vitality of the tooth should be preserved. No post-treatment signs or symptoms such as sensitivity, pain or swelling should be evident, and there should be no radiographic evidence of internal or external root resorption or other pathological changes. Teeth with immature roots should show continued root development and apexogenesis.
So starting with the procedural steps for the indirect pulp capping, ideally indirect pulp capping is done in 2 steps. First step is removal of the carious process, and second step is placement of the final restoration. But recent advances suggest that rather than completely removing the carious processes in 2 appointments, the focus has been to excavate as close as possible to the pulp and place a protective liner, restore the tooth without a subsequent re-entry to remove any remaining affected dentine. So finishing the indirect pulp capping procedure in 1 appointment will reduce the chances of pulpal exposure on subsequent re-entry into the prepared cavity. So starting with the steps, here you can see we have simulated a carious lesion. Now we will start with the excavation of the caries. You can see here we have removed the carious lesion. The cavity has been prepared. The margins of the cavity are clear of the caries. Only the center part you can see some caries left. We have avoided to remove this caries because subsequent removal will cause the pulpal exposure. Next step is we have to wash the cavity with the saline, dry it with the cotton pellet, and application of the pulp medicament agent. There are various pulp medicament agents available. Here for this video we are using the calcium hydroxide based pulp medicament agent. Calcium hydroxide based pulp capping agents can be available in 2 forms. In this form it is available as a base and catalyst base. So we have to mix the equal amount of base and catalyst paste, and the setting reaction will be achieved by the chemical setting. Second form is the light cured calcium hydroxide. You have to place it directly in the cavity and cure it with the help of an ultraviolet light. Here we are using light cured calcium hydroxide pulp capping agent. It is provided with a angulated tip. This helps in precise placement of the medicament. As you can see, we have applied the pulp capping agent only where there is a deep carious lesion. It is not applied on the margins. We will cure it with the light cure unit. Curing will be done for the 20 seconds. After the placement of the pulp capping agent, final restoration will be done using a sandwich technique. For sandwich technique, we will be placing a thin layer of a glass ionomer restoration over the pulp capping material. After the placement of the glass ionomer cement, the permanent restoration will be done using a composite resin material to achieve a good hermetic seal. As you can see here, permanent restoration is done with the help of composite resin material to achieve a good homeotic seal.